So how we do this is we're here till 7:30.
We just sit here until somebody shows up.
Because public comment is on at 7:30, you can't, when it's a public hearing, therefore you can't not be here until 7:30. That's why I said if I'd known, I'd
I
move
didn't
it up
even,
first.
I didn't even look at that.
But you'd figure you'd get a few people. I didn't think nobody. All right, but we should, anyways, if we're all here, we should call the meeting to order.
Really, I guess we can do that.
Sit first.
Oh, sorry. Well, you have plenty of time, Carrie, because we're gonna be here for a half an hour looking at each other.
Okay. So this is just a dress rehearsal.
That's right.
Yeah.
Nobody's. Cool. Hi, everybody.
We don't need bulletproof vests for tonight.
Oh,
We will.
jeez. Make it all the fun. Okay.
So it is trying to get his.
Oh, thank you. I just didn't think anybody needed to see me kind of, throwing my stuff all over the place. Ah, what a beautiful day and night. Okay, I'm in.
You know, we didn't specify that this is Eastern Standard Time or, I mean, this could be Atlantic time.
AM.
Jeez.
Well, it does say up here, 7 PM is the time, so that ties it.
But it's just not which time zone.
What time zone?
Yeah, I was thinking if it was a different time zone, then we would have to say something. Okay, so we can call the meeting to order. I have a motion to call the hearing to.
Do we need to have our CTV on first?
They are on.
They are,
Yeah,
okay.
Okay,
I think, so, actually, you called the Board of Health. Is it a Board of Health meeting as well, right?
it's Board of
So
Health.
call the Board of Health meeting together, and then we can motion,
Okay,
and I'll make a motion.
okay, let's convene the Board of Health. Can we do a roll call, starting with Joan?
Here,
Yes.
Rick Lopez, yes.
Carrie Danell, yes.
Paula Curran, yes.
Great. Can I have a motion to open the public hearing regarding the Community Health Improvement Plan?
So moved.
Second?
Second.
Roll call. Joan?
Yes.
Nevin?
Yes.
Rick? Yes.
Carrie, yes.
Paula, yes.
I know we're all very used to it, but we don't actually have to roll call. Because we're together.
Oh, we don't?
Show of hands.
Oh, yeah, the roll call is when we're.
It's good
on
redundancy.
remote.
It
But
is,
when we're
right.
on
Good
remote.
redundancy, but-
With redundancy, but we don't have.
That's right.
Crossing the Ts, dotting the Is.
It's weird,
Yeah.
right?
We're so used to
I know.
running that way, yep.
So I think we should hold off on the agenda until, or if we get some public members. Would you agree?
Yep.
I mean,
Yeah.
We've already seen the
yes.
assessment.
Yep. So we'll just hang tight for now and we'll see.
Did we hear from anyone that they might be interested in?
One or two,
Okay.
yeah.
Any of our community partners that weighed in on the, yeah.
Well, you know, the plan is not terribly controversial.
No.
It's kind of like
It is
mother
not.
and apple pie and
Yeah,
It's all
it's a
positive.
really good plan.
It is.
Yeah.
It's
It
a
is a
very
good
good
plan.
plan.
Even Narcissa is not here. So, what's going on?
Who announces when we get a visitor online? Oh, you still do? No?
What?
Who announces when we get a visitor online?
We're not doing Zoom.
Oh,
so
there's
yeah.
no Zoom, it's
Yeah, in person.
solely in person.
Yeah.
Got it.
Well,
Thank you for that
RCTV, they're gonna
clarification.
broadcast.
But it's recording and broadcasting.
Right.
Got it.
Right.
Thank you.
So why wouldn't we do the presentation for our CTV for the public to see?
Oh, we can do that. That would make sense.
That's a good point. Paul.
I was thinking we might wait to see if there's anybody here. But,
But the public comments at the end anyway, so.
right. But the purpose of the presentation was to educate the public.
Inform the public, right,
Yeah.
so that's the.
Maybe they're watching.
Yeah.
Yeah.
We can all
To
hope.
Paula's
Okay.
point, I think it's a good point. You gotta go through the motion.
Okay. So let me just make a comment or two that, oh, great.
That's what I was talking to.
So this public hearing is really held to provide feedback and suggestions to the board on this community health improvement plan, which is the outcome of a year-long process that the board undertook of a community health needs assessment, which was done with a planning committee and with several town entities and boards and commissions, as well as with the assistance of Peer Associates, our consulting group. The focus of the hearing is not the process, the health improvement, health needs assessment process or the nature of the three goals, but really on action steps as to how to achieve those goals. And really this whole process is very much a best practice in public health that really most boards of health, should be creating every 3 to 5 years an assessment of the health in the community as well as a health improvement plan. The last one done in Reading was in 2015. Probably we would have done one in 2020, but we had something called the pandemic, which was a little distracting. And so we've been undergoing this process over the past year and a half. So for this hearing, we want to hear from the public if there are any comments and suggestions. We're really not going to take a vote tonight. And our purpose is not to engage in a dialogue or back and forth, but really to hear any suggestions that the public would have. The ground rules are basically for anyone who wants to make a comment to sign in at the sign-in sheet. And then when your name is called, you can stand at the podium, give your name and address, and please limit your comments to 5 minutes, and I'll let you know or raise my hand. But before we begin, I thought we would ask Jamie Hobecky from Peer Associates, who we've been working with, to provide an overview of what the process is that we've undergone and where we are today, to kind of get everybody up to date. As well, the complete document or draft of the complete document is on the Board of Health website and can be accessed through the QR code on the agenda for the meeting that was posted. So with that, I'll just turn it over to Jamie.
Great, thank you so much, Dr. Lopez. So, as was mentioned, this has been a year-long process to really first start with a community health needs assessment. So through that assessment process, we were able to really think about what does health mean to the town of Reading, and in particular, really identify this need to think about health in terms of upstream drivers of health. So it's more than just someone's access to health care as we know it. It's also more than just the presence or absence of disease. It's really thinking about some of the other factors that we know impact someone's ability to lead a healthy life. Things that could be like your income, education level, access to basic resources like food, and quality food in particular, are all a part of how Reading and the planning team and the folks we heard from in the community think about health. So that really served as the foundation for how we put together the community health needs assessment. Through that process, there were two primary data sources that we used. The first was to think about what's available quantitatively already through national sources, state sources, and local sources of data. So things like the Massachusetts Public Health Information Tool, that's put out by the Massachusetts Department of Public Health as one example. There's some community profiles and information about Reading we were able to source there. And then there's some larger public health population level data sources that we used, things like the Behavioral Risk Factor Surveillance Survey that's put out by the CDC to look at adult related health behaviors and risk factors. And then a complement to that is there's a youth version of the same tool that is conducted here within Reading Public Schools and other schools across the country, where we're able to pull some information about health and behaviors and some of the risk factors. So we took those data sources and then we constructed some questions and opportunity to hear from the public. So we did some key leader interviews where we connected with folks in the community to hear about their experience with health in Reading and an opportunity to listen to what they felt were the health needs and the leading issues to be addressed within Reading, and then also where are some of the strengths and areas to build on, and Reading certainly has a lot of strengths as well. And then we did some focus groups with community members as well, and heard from municipal, like local town leaders. We heard from some of the general population and folks that might have loved ones or they themselves might be experiencing disabilities. We reached out to a larger racial and ethnic population and make sure that we were thinking of things in terms of equity and hearing from all voices. And we also talked with youth leaders about their experience with children and some of the things that they were seeing. So we did 4 of those types of focus groups to hear from individuals. And then lastly, we conducted a survey tool that we put out to the community as a convenience sample. So there was no sort of scientific base behind it, but you don't typically see that as a part of a needs assessment process. It's just an opportunity to, again, hear from the community as one way to get feedback about what are those health needs, what are some of the strengths, and then where are some of the opportunities. And I feel like the real power in some of the feedback we received is what you would do about some of the things you're seeing locally within Reading, and we were able to get a lot of great feedback in that way from the community. We took all of that information and distilled it into the needs that you see within the community health needs assessment. And then from there, the planning team that was meeting further prioritized those needs and identified 3 areas where we really want to dig into in terms of the community health improvement plan for Reading. Realizing that all of the needs and information surfaced within the community health needs assessment is certainly important. It's just where do we have the leverage and opportunity to make an impact in Reading within your CHIP, or your community health improvement plan. So certain considerations for understanding how those priorities were arrived at were things like the ability to control the need and make an improvement. So within public health, as we know, there's a local health department, but a health department in and of itself cannot move these larger scale health issues. It needs to be a collaboration and partnership across town agencies, across community partners and nonprofits, across schools, and lots of entities coming together to make a difference. So the ability for collaboration and consideration on some of the needs that were raised was an incredibly important point as well. So all of that was taken into consideration, and what came from it was 3 distinct areas. The first is about preventive health screenings and treatment services. The second area is about healthy environments and inclusive programs. And the third priority area is about healthy eating and active living. Under each of those areas, the planning team worked together to identify goals for how we want to take action within those 3 primary priority need areas. So under preventive health screenings and treatment services, the 2 goals there are around increasing awareness about what already exists within the community and through some of the healthcare partners in particular, and also thinking about access to, so things like transportation barriers or cost for folks who really want to access preventive primary health care. So really getting into screenings like mammograms and colorectal cancer screenings, blood pressure screenings, and your ability to access care ahead of disease prevalence or issues with conditions related to chronic diseases. And then we also, for the second goal, focused in on mental health and behavioral health treatment services for those in need of support. And that came out of a lot of the feedback we received from the community and community leaders broadly defined around the inability to access timely support services as it relates to mental health services. And it was across the lifespan. So it was for children and adults likely having access to access issues to mental health and behavioral health treatment services. So ways to support linkages to existing programs and also potentially build and bolster partnerships to improve access to those treatment services. The second area that I mentioned was healthy environments and inclusive programs. So this one is really about creating those healthy places, spaces, and programs for people of all ages and abilities. And I want to underscore here, we heard loud and clear from folks across the community that it's not necessarily about creating a new program for someone who is experiencing a disability or creating a program specific to a population that speaks another language other than English. It's about looking at existing programming and adapting it so that it is inclusive. And so that you're building out that opportunity to ensure that what is offered here is welcoming to all. Also, under this area, we talked about increasing opportunities for community connections and supportive services. So really thinking about where are some of the community places where folks could come together and support one another. And there's a fair amount of existing wonderful events that happen within Reading that could be built on in particular to really support those connections, and certainly some talk while we were doing this around the senior center and or community center location to really build that community connection and provide those types of supportive services in a centralized manner. Lastly, under this category is about building resiliency for youth and young adults. Again, thinking about getting upstream, like so getting ahead of some of the risk behaviors and supporting youth to avoid tobacco use, supporting youth to think about their mental health and plug into enrichment programming and services to really help connect them to community as well. And then lastly, there's an area on healthy eating, active living. And this one is really about healthy behaviors and the promotion of healthy behaviors across the lifespan, with a focus on trying to make the healthy choice the easy choice. So when you think about healthy eating, in particular, thinking about opportunities for farmers markets and ways to bring healthy, affordable food options into the community. Thinking about the way trails and other resources locally are built for destinations and walkability within neighborhoods, and thinking about destinations like schools or the senior center or other places for recreation, and really embracing that healthy eating, active living concept that other communities have across the country. So tonight, as Dr. Lopez mentioned, the focus here is to really think about those goal areas and the strategies themselves. We're not necessarily talking about whether those are the right goal areas at this point, but talking about what do we do about the goals that were raised and what are those opportunities for strategies, and to hear from the public about their ideas to move the CHIP plan forward. So with that, the last slide here is just a recap of the priority areas that I went over for supporting any public comment and further discussion.
Great. Thank you, Jamie. Appreciate it. At this point, we are open for public comment. If anyone in the audience wants to make a comment, feel free to come up to the podium. We are going to keep the floor open until 7:30 per our agenda. And we'll kind of go from there. So right now, Marilyn.
You didn't put my name on this agenda. I'm Marilyn Shapley, 11 John Carver Road, and I've been part of the planning on this for the sake of the Zoom and their knowing. It's a challenge. I'm on the Council on Aging. I'm here to introduce Nancy Zimlak as our current chair. I was chair when I started on this committee, but passed it on to her capable hands. One of the challenges we face is that I struggle with anyway most, is that people are not of the frame of mind or experience to think of older people as part of the community in the same sense as younger people. And how you make younger people realize that having programs to support all these things you're talking about up here for older people benefits the whole community, not just older people. And I think that people grasp that well when you think, for example, about schools. And personally, I'm very supportive of everything that's going on to improve the school situation in town. But I'll never set foot in that new school when it's built, almost certainly. I don't have children, I don't have grandchildren. I'm not worried about anyone in immediate relation to me in their education, but I absolutely understand having really good schools is really important for the whole country, not just the community. So that makes sense, and my vote will go that way unless something bizarre happens. But the reverse doesn't happen very much, I don't think. And one of the things we're working hard to do is support the position the select board came out with in the beginning. It's not either or between old people in schools or anything else. There's another project out there competing as well. They're not competing, it's not or. And you can get people to hear those words, but to get it translated into action, to make people aware of all ages being part of the community, and that if you let older people suffer, it's going to cascade through the community in a million different ways, is a real challenge that I would love to hear more thoughts or engage in a dialogue in how the Board of Health could help make awareness of that key to how we go forward, because there are lots of issues facing us. There's lots of people. We're up to 7,500 age 60 plus people. By next year at this rate there'll be 8,000, which is about 30% of the total population of Reading. If you took just of the voting age people, I haven't done the math, but in my head I'm thinking it's creeping up towards 40% of even voters, and even to make them aware you have a way to speak and you have issues that relate to you. So any thoughts on how the Board of Health can help make this a community challenge? I think that it fits right in with this, and whatever I can do to help, I would be excited to do it. So anyway, thank you for this, and I was really glad of the opportunity to be involved, to speak up on behalf of older people's perspective in this. And I know sometimes that was really noisy, but anyway, thank you for listening to my racket. I think it paid off.
Thank you.
Thanks, Marilyn.
Appreciate it.
You're a good advocate.
Thank you. I try.
As Marilyn said, I'm the current chair of the Council on Aging. My name's Nancy Zimlak. I really wasn't planning to speak tonight, but number one up there, preventive health screening and treatment services. One of our problems is being able to reach out to all of the people that either need the services, they need to know about the services. And in this day and age, it's very difficult. In the old days, I lived in Ipswich, we had the Ipswich Chronicle, everybody got it on Thursdays and everybody read it. It was full of local news about where to go for blood pressure or, whatever. But we don't have that nowadays. And we're struggling trying to figure out how do we reach out, you know, is it whichever, postcards or letters, or personally, I use the town website, but I don't think everybody does that. I think it's an excellent resource of information. It's the local paper online. And, you know, for all of these things, it's getting the word out to the people that need to hear it, getting them the services, and then doing the follow-up. So, and I have a feeling this whole reaching out and trying to discover, you know, who are the groups out there. It's not just us at the Council of Aging, it's probably the Board of Health too, and conservation, and whatever groups are out there. So I think that's I think that fits in with number one, and it's just something, I wish I had an answer, but I don't. But I did not thoroughly read the report, but I do appreciate, I was getting reports from Marilyn, and I do appreciate the emphasis or the inclusion of the older adult community in this whole discussion, because, you know, in Reading, we're into sports, we're into the kids, which is great. But we also have to remember that there are other people out there. And so, thank you for doing that.
Thank you so much. Appreciate your comments. I think at this moment, we'll probably wait a minute or two, see if there's any additional members of the public, and we'll kind of go from there.
Just sign the sheet since we spoke.
Yes, please. I put together some comments based on that NHB. And I'll email it to you tomorrow. You can edit it. Yes. For my own things, I didn't include, you know, no boobs or anything like this, because I didn't think this was going to be controversial.
Right.
But you may need to do that.
Oh, gosh.
I feel guilty leaving you high and dry.
Well, I'm not high and dry. I'm Kevin's gonna be here, and Joan's gonna be here a day, but I'm gonna miss him. But thank you. Gaz will be here.
Right, I think, wait for it. Okay. Any second.
So we are, just to clarify, so we're not taking votes, so we're just closing the public comment
close the
section of the
hearing.
public hearing.
That's correct.
And we're continuing the public hearing to our next Board of Health meeting.
No, I think the idea was, when the notice went out for this hearing, people were invited to either come to this hearing to give comments, or to send written comments to a day, you know, by the end of the day today. And so I think we have all the feedback we're going to have. I think at our next board meeting, we would have a discussion of where we stand with the needs assessment, health improvement plan, and want to make any modifications based on the comments we received, and try to finalize. I don't think we would necessarily have, you know,
Extend the hearing.
extend the hearing to next meeting, because we do have some other issues that we need to go over.
Yeah, no, the reason I bring it up is because then you can just close the public hearing today.
Yes, that was my,
Okay,
my.
not just the public comment
Oh,
section of the public hearing.
Right.
So there's two trains of thoughts. If you want to just keep it open, so then when we do meet next, we can just vote on it.
Yep.
Obviously discussion vote, at that time. And then, but I don't think it matters one way or the other. I think we could just have it as a normal item as well too. And if that's the case,
Yep.
you just close the whole thing today.
Okay. So at this point, I think I would ask for a motion to close the public hearing and public comment.
So moved?
Second,
Happy to second.
roll call, Joan,
Yes.
Kevin,
Yes.
Yep. Yes. Okay. And with that, I'll also adjourn the Board of Health meeting. I'm gonna make a motion to do so. Do I have a second?
Second.
Second. Roll call, Joan, Kevin, Rick, Mary, and Paul. Thank you,
All right.
and thank you for coming.
Thank you.
Yeah.